Welcome back, folks. We are honored to be joined by Dr. Robert Johnson, Dean of the Rutgers, New Jersey Medical School, and also Interim Dean, Rutgers, Robert Wood Johnson Medical School. Good to see you, Dr. Johnson.
Good to see you again, too, Steve.
We've learned so much from you over the years when you've been with us, talking about a whole range of complex healthcare issues. Talk to us about, from your perspective, not just as a dean of a medical school, but also one of the best clinicians in the country, the impact of COVID as you've seen it, particularly with the population that you are most concerned about in the urban communities that we serve.
Well, you know, I've been practicing medicine for about 50 years now, and I've never seen anything like this. And I guess the only people who are around who've seen anything like this lived back during the Spanish flu. And it's had an impact on every strata of society. It's had a profound impact on the practice of medicine. We had to learn how to do things differently in hospitals, and we found out that we could dramatically change the systems in hospitals, the way people work, and we got people work together to take care of some very, very seriously ill people, and now we're recovering in hospitals. We've had to develop different ways of practicing medicine on the ambulatory setting. We're now doing telehealth, something we probably should have done for some time, but now we're doing it real time, and it's working out well. But even more than that, it's the effect on society. People have quarantined or been in place, at least where we live in the Northeast, for 2 or 3 months. And they've lived with that. They've learned how to change interaction. No one shakes hands anymore. Everyone's walking around with a mask. And everyone has isolated themselves away from the things they use to relax and calm down. The other thing I think is a great societal impact on changes within society. I think the Black Lives Matters movement and the effect that we've had COVID coming at the same time, there's some connection there. And I think it's right now we see an association. I don't think we know yet what the causal connection is, but you know, people can speculate. But that's also been a big change. And the other thing is, I don't know where we're going after this. I don't know that we're going to be able to be different.
Bob, we've been together 20 years. If you don't know where we're going, what about the rest of us? Well, I count on you. We all do.
It's really hard, because how are we going to educate our children? How are we going to develop the social interactions that are very important on college campuses? How are young professors who are in medicine or any other profession going to interact and learn from colleagues, since they're not going to be with colleagues anymore, they're going to be on a computer. So all of these things, these really big sea changes in society are occurring as a result of this, and it's never happened before. I think it's really exciting, because I'd like to see where we're going to go. And I think that where we're going to go is probably a good thing, but it's going to be tough getting there.
You know, it's so interesting. In all seriousness, Dr. Johnson, you've been with us for about 20 years in the studio, one-on-one interviews, panel discussions. You say you're excited. You also understand people are afraid, and there's a lot of uncertainty. So here's my question. To what degree do you believe, when it comes to medical school or the physicians of tomorrow, that their skills, their paradigm, their worldview has to also change dramatically with so much uncertainty about the future?
Well, it has to change. And, you know, the last time, and you and I probably talked about this 20 years ago with HIV, you know, that was, at that point, that was the biggest thing that happened in my professional life. And we changed the way in which we interacted with patients, and our physicians, our healthcare professionals developed new skills and new ways of discovering what was going on with the patient. That's happening now. Our students are learning new things, and even old people like me are learning new ways of interacting with patients. And so I think those skills, those new skills, are going to be a good thing for us. I think the fact that we are questioning everything we do in healthcare, as a matter of fact, for example, since we're going to do a lot of medicine on the telephone, that means that there are tests that we would have ordered if the patient were in front of us that we're not ordering now. Now, if the outcomes are the same, maybe we shouldn't order those tests in the first place. So that's just a small example of things that are happening and going into the future that are going to be, I think, ultimately good for all of us.
Dr. Johnson,
that's the way I look at the world. You know, I think everything that is bad happens is good eventually.
You know, Again, one of the other areas that you and I have talked about extensively, and again, this is part of a series we're doing called Confronting Racism. We've talked about social determinants of health. The connection between the social determinants of health and confronting racism. Go ahead.
Well, it's a very big part of it because those social determinants are based on race. So race.
Such as, lace them out, doctor, please.
For example, the way in which people who are Black and brown interact with the healthcare profession that is not usually interacting with them. So we know that Black patients usually get different qualities of treatment. They're less likely to get pain medications. The infant mortality rate is higher. Every negative statistic you can look at is higher if you're Black and brown. Now, we don't know all the reasons for that. We know that within healthcare, there's something that causes that, but that's probably not just within healthcare, it's in society in general. But in the healthcare environment, we have to compensate for the things that are in society that lead to lead to adverse racial outcomes. And now we're confronting that. We are confronting that real time, and it's the way in which society has had this plus and minus of back and forth interaction of what's going on in health. And we're having real meaningful discussions now about what, in academic medicine, what is it that we have to do to make sure that we get equal outcomes in all segments of the population.
Final question, Dr. Johnson. Give us a reason to be optimistic about
the future
moving forward.
Yeah.
Just give us a reason. Don't make it up, because I know you won't, but just give us a reason to be optimistic.
I won't make it up. The best reason to be optimistic is we've been here before and we've come through it. If you look at, there was an article in the Ledger yesterday about the Spanish flu.
We're taping on the 13th. I'm sorry, we're taping on the 13th of July. It'll be seen later. Go ahead, Bob.
Exactly. There's an article about the Spanish flu. And the Rutgers football team playing during the Spanish flu pandemic in the New Brunswick area. And we got through all of that, and we thrived. We got through HIV. We got through everything. So we are very resilient. And because of that resilience, we go through what we have to go through, and we end up on the other side better. Now, you can know that if you live long enough. If you haven't lived a long time, then you can become very pessimistic.
Well, Dr. Johnson, you have more work to do. We have more to learn from you, and you honor us by your presence, by your time, and most importantly, by those 50 years that you talked about helping others. Thank you, Bob.
Thank you. Bye-bye.
Take care, my friend. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by RWJ Barnabas Health, Johnson & Johnson, Gibbons PC, PSC&G, the Turrell Fund, supporting Reimagine Childcare, the New Jersey Education Association, the Healthcare Foundation of New Jersey, and by the Fidelco Group. Promotional support provided by Jaffe Communications and by NorthJersey.com and Local IQ, part of the USA Today network.
In the fabric of America, they are the toughest threads. One of the first things they learned was the code that every service member lives by: leave no one behind. Now all of us need to live by it too, because some veterans are being left behind. 20 of them take their own lives every day. Learn how to be there for a veteran at BeThereForVeterans.com. Honor the code. Be there. Leave no one behind.